Major change in some guidance from the CDC about how coronavirus can be transmitted. Here to talk it through with us, Dr. Sharon Wright, Senior Medical Director of Infection Control and Hospital Epidemiology at Beth Israel Deaconess Medical Center. Good to see you.
Good to see you too.
So recently the agency said coronavirus could be transmitted in the air, and that's after several studies showed those tiny particles, those respiratory droplets from a cough, sneeze, even talking, could infect another person who's in close contact. Now the CDC has reversed that. So what do we know about the shift?
It's hard to know what caused the CDC to retract that document. Perhaps it wasn't ready yet, but I think we should keep in mind that it really isn't just one or the other, but more of a continuum. So we know that COVID is largely transmitted similar to influenza by large respiratory droplets, but that in certain situations, which has also always been true for influenza, when you have very close, unprotected contact without a mask on in closed settings with limited ventilation in small spaces especially, that you can have those droplets hang in the air longer. So it's not necessarily truly airborne like measles or tuberculosis, but really that there can be a range of ways that it's transmitted.
Okay, I think the part that's tough for people is that this isn't the first time it's happened with the CDC saying one thing and then it changes. Is it unusual for the agency to go back and forth like this?
Well, I think there's probably two things going on. One is that we've never seen so much science come out so quickly about an emerging infection. There's over 50,000 papers, if you look on some of the websites, that have been published since the beginning of the pandemic. And so there's a lot to evaluate and look at the quality of the science. And I think even back during H1N1, initially respirators were recommended, and then the CDC eventually moved over to surgical masks. So that's probably part of it. And then I think, as a country, for reasons that aren't entirely clear to me, we're not letting the CDC lead the country and the world the way that it usually does in settings of infectious crises.
Okay, so you touched on this a moment ago, but bottom line, coronavirus, it's on a continuum, but there can be airborne transmission.
I think some of it's semantics, whether you say that it's truly airborne or aerosols of droplets like spray, like you're saying from a cough or a sneeze, that can hang in the air a little bit longer under certain conditions when you're in near range, but not something that's truly airborne that will most likely travel down the hall, around the corner, or long distances.
Okay. The distinction's important. All right, thank you for the clarity there. The U.S. hitting this pretty grim milestone, 200,000 deaths tied to COVID-19. In Massachusetts, we recently passed 9,000. What are some of the details beyond the numbers? Are there any common traits among those people who have died, and has that changed at all between March and now?
I think, across the country, we're seeing some similar risk factors. So certainly patients over the age of 65, persons with other illnesses, especially chronic illnesses, are at higher risk. I think, in the beginning of the pandemic, especially in Massachusetts, we were seeing a big focus on the elderly in nursing homes. But now that we've been able to put in a lot of preventative measures, as well as personal protective equipment and especially testing in those settings, we've been able to reverse that a little bit. But those groups are still at the most risk. Additionally, we're seeing, especially in those under 65, that non-white populations are at highest risk. And I know that Massachusetts, as well as many other parts of the country, are working hard to try to combat that.
All right, Dr. Wright, thank you for your time, your insight. We really appreciate it, as always.
Thanks for having me.